what are the key lessons the COVID pandemic has taught us about the limits of voluntary mechanisms in regulating corporate greed? And Fatima, I think you touched on that based on your conversation webinar yesterday. What has it revealed about the quandaries of relying on aspects of legally binding frameworks that aim to promote health, but routinely fail in practice? How can these lessons be applied to efforts to develop a pandemic treaty and the UN Treaty on Transnational Corporations and Human Rights? So I don't know who feels more comfortable trying to take that on. I mean, I think, Fatima, you sort of addressed the fact that it's clear that we can no longer count on companies to do these things on a voluntary basis. Yeah, and I see Kamran is also bursting to chime in. So Kamran, why don't we start with you?
I'll just keep it short. I mean, the simple fact is voluntary mechanisms do not work. They have never worked for the pharma industry. It's just a way of voluntary or self-regulation. These things don't work. They're just ways to dodge responsibility, as far as I'm concerned, to dodge corporate responsibility. The second half of that was about regulatory frameworks. I don't know of any. I mean, this is the problem. So the companies are only accountable to their boards. There weren't any regulatory frameworks necessarily that were legally binding upon them that I'm aware of. I'm not a lawyer, and that's why and hence that accountability had to come through elected representatives, through the politicians. They were the ones that had to act like with a conscience, a global conscience, and exert that sort of power and enforce that responsibility upon corporations. They haven't done so because they're sort of in bed together for all sorts of historical reasons, and racism and colonialism are tied up with that, very much so. We know that. So then, looking ahead, when it comes to this is why clearly, there's work being done on the pandemic treaty. I think we all hope that it comes about, because one of the questions have been, how do you make any individual country or corporation that's based in that company globally responsible? And we generally do not have mechanisms in public health to make that happen. Some of that has started to happen because of climate change. We now need to introduce that for public health and other health initiatives. So, yes, out of the despair, there is optimism, there are ways forward, but ultimately it all boils down to the willingness of countries to abide by those treaties, and whatever teeth that can be put into those agreements. I'm not a lawyer. There are other lawyers on this webinar. They need to be put in place. There is, when we think about leadership, that's been the one, if we'd say one thing that has led to the crisis that we're in now. It is, and if you only to pick one thing, it's the absolute failure of leadership in the rich world, but also in Africa. I'm really interested to hear some of these ideas around how Africa can be mobilized to say, this is it, enough is enough, and to stand up for the continent. I mean, I know of this from being a South Asian. The leaders reflect the problems and the aspirations of their populations. The same in the Middle East, the same in Africa, the same in South America. It's that disconnect between the aspirations of the populace and also the greed of local politicians that is then compounded by the greed that you get from the richer countries. So if I think, just to finish, there was somebody, a public health person in the UK, not about Matt Hancock, but we said, well, what can we do about this? We feel powerless. And they said, well, I've spoken to my MP, and the MP says the only way we can get out of this is through the courts. So we're all looking to the lawyers. The future of humanity is in your hands. How can you create legally binding mechanisms that will hold leaders accountable? That's the challenge.